You know, we taxpayers are footing the bill for some pretty big salaries here in the state of Ohio.
So who's getting the paycheck? 2 News reporter Charlisa Gordon is digging deeper into those big salaries, and the people getting them might be surprised.
Ohio is spending $1 billion a year to fight the opioid epidemic, and you're fronting the bill. Medical treatment is the biggest ticket item in the budget, and with more than half going towards salaries.
You've seen the pictures: grandparents, mothers, fathers, couples. As the body count rises, Ohio is pouring money into the war on opioids.
There's an exploitation of the desperation of drug addicts.
19 out of the 20 highest paid state employees work in the mental health and drug addiction field, with the top earner making just shy of $500,000.
You're going to draw people who are the sincere people, and you're going to simultaneously draw the people who are going to stuff their pockets with the maximum amount of funds.
Dr. Abdul Mubarak is not on the list of the top paid state employees, but he is an addiction specialist. He's been on the front line of the epidemic for over 30 years. He says it's a classic case of supply and demand. And despite the money being spent, Mubarak says we're losing the battle.
The number of doctors who are actually going into this area have increased, but it's not nearly enough. So you're not going to have 2% to be able to meet a whole epidemic.
This is Ohio's billion-dollar drug receipt. Law enforcement, jails, jobs and family services, health care. $650 million of taxpayers' money being spent on high doctors' salaries. But for some, no amount of money is too much to fight the war on heroin.
I don't know that life will ever be the same.
Richard Comfort walks the hallways of this treatment center he opened 2 years ago to help his daughters.
I passed my first drug test on Monday. Congratulations.
We were there listening to recovering addicts talk about their journey to sobriety.
I don't feel like I'm going to relapse.
I'd hoped that maybe my girls be spared, but losing my daughter is like losing a piece of me.
Her death made headlines, and we covered it.
Just before noon on April 13th, first responders found her body in the 1600 block of North Kiwi, the victim of an apparent overdose.
There's a moment go by that I don't think about her, and I miss my princess.
Now he's wondering, are all the salaries, plans, and campaigns even making a dent in the opioid crisis? I went to Columbus to ask state officials if they believe it's working.
You have law enforcement saying you can't arrest your way out of this crisis. Are we trying to spend our way out of it?
There's no silver bullet answer to this challenge. I think it's really multifaceted. Every Ohioan is someone's son or daughter, oftentimes someone's parent. To try to save a life, if we are able to do so, means that that person may have another chance at treatment and recovery.
I don't believe anybody has to lose their life to this.
This year, the state passed legislation to shut down pill mills from cranking out pain medication. It's also allowing for-profit providers to establish treatment centers in the areas that need it the most. For the full breakdown of how the tax dollars are being spent to fight the war on heroin and the list of the top 20 paid state employees, visit our website at WDTN.com. Charlisa Gordon, 2 News, working for you.